CSF finding in Pyogenic meningitis. CSF changes in pyogenic meningitis. Pyogenic meningitis is a bacterial infection of meningitis, the protective membrane covering the brain and spinal cord. CSF finding in pyogenic meningitis. In pyogenic meningitis, cerebrospinal fluid (CSF) analysis play a crucial role in diagnosis. The condition below are the typical CSF changes in this condition. Appearance of CSF cloudy or turbid. The CSF become cloudy due to the presence of pus cell, polymorphonuclear leukocyte, bacteria, and cellular debris. It may appear plurulent pulse-like severe cases. Cell count pleurocytosis, increased white blood cell WBC. The WBC count is markedly evaluated primarily due to neutrophils, polymorphonuclear cell. Normal CSF WBC count 0 to 5 cells UL, but in pyogenic meningitis it can range 1000 to 10,000 cells UL or even higher. Neutrophil predominance, over 90% of cells are neutrophil, reflecting the bacteria infection. Glucose level. Decreased glucose CSF glucose level are significantly reduced in pyogenic meningitis. Normal CSF glucose 40 to 70 mg per dl. In bacteria meningitis, glucose level usually fall to less than 40 mg dl. This decreased glucose is due to the consumption of glucose by the bacteria and inflammatory cell. Protein level. Increased protein. The protein concentration in CSF is evaluated in pyogenic meningitis. Normal CSF protein 20 to 45 mg per dl, but in pyogenic meningitis it can rise to 100 to 500 mg per dl. The increase is due to the inflammatory response and the breakdown of blood-brain barrier integrity. Gram stain and culture. Gram stain is a pyogenic meningitis. The CSF may show bacteria upon gram staining. Bacteria culture of CSF can grow the causative organism: Neisseria, meningitis, Streptococcus pneumonia, Haemophilus influenza. The culture is critical for identifying the specific organism and determine the antibiotic susceptibility. Lactate levels. Evaluate CSF lactate. Lactase levels are often increased in pyogenic meningitis due to the anaerobic metabolism caused by infection. Normal lactal levels are less than 25 mg per dl due to bacterial meningitis. This may exceed 25 mg per dl. Opening pressure. Increased opening pressure. The CSF opening pressure can be evaluated due to increased intracranial pressure. Normal CSF pressure 70 to 180 mmHg. OS20 is bacterial meningitis. It may rise from 200 mm S20. Other special tests. Latex glutination test can be used to detect bacterial antigen in the CSF. Polymerase chain reaction PCR can be used to detect the DNA of the causative microorganism in CSF. Summary of CSF changes is pyogenic meningitis parameter normal value, pyogenic meningitis appearance clear, cloudy turbid, WBC count 0 to 5 cell, cell 1000 to 10,000 cell, neutrophil predominance, CSF glucose 40 to 70 mg per dl, greater than 40 mg per dl, CSF protein 24 to 5 mg per dl, 100 to 500 mg per dl, CSF lactate 25 mg per dl, 25 mg dl. Gram stain negative, positive for bacteria. Culture or no growth, positive for bacteria. Opening pressure 70 to 180 mm S20, 200 mm S20. Conclusion is CSF analysis is essential diagnostic tool in pyogenic meningitis. This character finding include a cloudy appearance, high WBC count, with neutrophil predominance, low glucose, elevated protein, possible positive gram stain. Culture. This finding, along with the critical symptom and immunohistory, help in confirming the diagnosis, guiding treatment decision for predominant meningitis.